Hypertension, the guide to exercising with high blood pressure. So what is hypertension? Hypertension is also known as high blood pressure, and it is often called the silent killer. This is because symptoms are often not shown with this condition. Having high blood pressure means that the pressure your blood is exerting against your artery walls is too high. High blood pressure is also a major risk factor for cardiovascular disease, which is why it is usually a comorbidity, meaning it usually exists with one or more other diseases. So blood pressure tends to change with age. So as we age, our blood pressure tends to gradually increase with age. And that'll happen until around 50 years old. Then it usually plateaus for about 10 years, and it'll start to decrease at around 60 years old. Many different things can cause high blood pressure, most being related to lifestyle factors such as diet and exercise, but others can include things like diabetes, pregnancy, and genetics. Because our blood pressure changes daily, a quick spike in blood pressure isn't going to cause any major problems. However, blood pressure that remains high for a long period of time could cause damage to important organs such as the eyes. Damage to the heart could cause heart failure, heart disease, heart attack, can cause stroke, as well as even kidney disease and failure. Hypertension is usually managed with medications. Some common medications used to treat hypertension are beta blockers and calcium channel blockers, which they will both lower blood pressure as well as heart rate. Something worth noting if you are training anyone who is on these type of medications is that because their heart rate can be affected by the medication, intensity during exercise should be monitored using Borg's RPE scale or the talk test. Another way to help improve hypertension is to change your lifestyle. So adding in a healthy diet, exercise, proper sleep, these are all great ways to help manage hypertension. Physician clearance will be needed for exercise if a consistent blood pressure of over 144/94 is continually taken. Immediate medical attention should be sought if blood pressure is higher than 180/120. That means that they are in a hypertensive crisis. There are things to consider when planning exercises for someone with hypertension. Isometric exercises, such as wall sits and planks, tend to increase blood pressure. This is due to the static muscle contraction causing an increase in blood vessel compression. Exercises that involve weights above the head are also not recommended since these can also increase blood pressure dramatically. Holding your breath can cause a spike in blood pressure, which is why the Valsalva maneuver should also be avoided during exercise. There are many different exercise options for people who have hypertension. Rather than doing an isometric exercise such as a plank, if you want to target your core, try a dynamic core exercise like the dead bug. So you will get your client to lie down onto the floor and allow the shoulders and lower back to fall heavy to the floor. Drawing your shoulders down away from your ears, get into the starting position. Hands should be in line with your shoulders. Lift your legs so your knees are directly over your hips. On an exhale, slowly lower your right arm and left leg until they are just above the floor. On an inhale, bring them back up to starting position, and you can repeat this on the opposite side. There are many modifications that you can also do to make this harder. You could use a body ball, or you can even add a weight, keeping in mind you might not want to choose too heavy of a weight to decrease the chance of a spike in blood pressure. A great way to add weight and tension to exercises for people with hypertension is to just make sure the weight is below the shoulders. An example of this is a goblet squat. Standing with your feet hip-width apart, you want to hold the dumbbell vertically, gripping it with both hands and keeping it close to your chest throughout the entire exercise. Pointing your knees in the same direction as your toes, inhale and begin to squat. Sitting back into your hips, keeping the core tight and torso upright. Stopping when your thighs are parallel or have just gone past the knee joint. After holding briefly, you're going to push into your heels and stand upright while squeezing those glutes. Hypertension should not stop your client from participating in exercise, and hopefully this video gave you a few tips to consider when creating a program for a client with high blood pressure.